Nationwide Children's Hospital is just weeks away from opening a first-of-its-kind facility. It's called the Big Lots Behavioral Health Pavilion. Its sole focus will be children with behavioral and mental health issues. So all month, NBC4 has been working with Nationwide Children's to highlight why the need for this type of facility is so great. We want to help break the stigma of mental illness, and we do that by talking about it with each other and with our kids. Here with us is Dr. John Ackerman. He is a suicide prevention coordinator for the Center for Suicide Prevention and Research at Nationwide Children's Hospital and will be for this new pavilion. Thanks so much for joining us tonight. Let's dive in. This is a tough topic to talk about with your kids. How do you even approach that?
I think the best thing to do is to find a time when you're with your children, you're feeling connected, that you're not waiting until there's a crisis. You're finding dinner time, a car ride, and you're checking in with them emotionally to see what their temperature's like and to make sure you can give them support when they need it.
All right, and you know, we hate to say this, but there is a need for this here. So there are going to be issues that parents might see or see in their children, their children's friends. What are those warning signs?
You're really looking for major changes in a person's behavior or their emotions. Maybe they're no longer enjoying things that they like to do. They're showing signs that it's really difficult to do lots of things that they care about. They're really feeling distressed or upset, they're having trouble sleeping or eating, and really at the end of the day they're feeling hopeless or like a burden. And when we see that, it's time to act.
And of course there's always school, you know, if their grades start to slip. We've heard that as well. But then there's also like playtime activities. You mentioned they don't love things as much as they used to anymore.
Yeah, it's sort of a change. When you're feeling depressed, when you're not feeling like life's worth living, the enjoyment that you get out of typical things, whether that's the activities you like doing, the work that you find enjoyable or rewarding, is no longer feeling that way. The other warning signs that we'd look at would be talking about death or dying, and that's an important thing to look out for as well, whether that's online or in person with friends.
And that's got to be a tough bridge to cross, but let's say a parent does see something or a family member in a child. What do you do? What is the most important thing you should do?
Step one is don't panic. This is an opportunity that your young one is signaling to you that they might be in emotional distress, that they want some help. They want someone to reach out to them and ask this question. And you want to ask them very directly, if you've noticed some of these warning signs. Have you thought about ending your life? Is suicide that's something you've considered? And that can be kind of jarring for a parent who's never gone into this topic, but we know it's really important, and you're not putting that idea into their mind. You're giving them a chance to feel relief and talk about it with someone who they care about. And I'm sure this might come up with a lot of parents. Where do you know that the line is that I need to bring in a professional? Is there a particular line, or is it a gut feeling? The line is when their normal everyday activities or their relationships are suffering, that something is different, or you may see one of these warning signs like talking about ending one's life, that it just needs to go to someone who can help make that distinction, and people who are trained in identifying whether it's a typical change or whether this is something that signifies a deeper emotional distress that needs to be evaluated.
Okay. And now that we've gone through all those things that we should consider doing, is there anything that we should consider not doing? Any no-nos of this particular subject with kids?
Yeah, well, talking about this, we got to understand it's scary, it's uncomfortable. So, and we want to, as adults, we want to solve the problem immediately. We want to be there for our kids and fix them. But really, that urge we need to fight against. We need to make sure that we are there with them and curious and empathetic and supporting them and being there with them, and fixing it right away is probably not going to happen. So we need to really listen, be present, be curious, and then work with a team of individuals to get that support.
All right. And this particular facility will be a great asset in that, right?
Absolutely. I think the Big Lots Behavioral Health Pavilion is going to be an opportunity to expand access to care, to support people, and to make sure we're doing the research and the support to make sure that we're preventing young people from even getting to the situation where a crisis or harming themselves is what they're considering. So we're going to try to do a lot of upstream work, and I think we can make a big impact for our community, and we're happy to be doing that here in Columbus.
All right, we're happy to have you here, Dr. Ackerman. Thanks so much for taking on this tough topic for us here at 5 o'clock. Thanks again so much. If you want to check out the new Big Lots Behavioral Health Pavilion, there's actually going to be an open house on March 1st. It's from 11 to 3. It's at the Nationwide Children's downtown main campus. That's on Butterfly Gardens Drive. Check that out. I know I'll be there. Colleen will be there. You can also check out our live stream. If you want to talk more about this tough topic, at 5:30, our Jared Smalley will be talking to Dr. Ackerman about this very topic, and he'll be asking your questions. So if you have any, let us know. You can watch through our website, NBC4i.com, our Facebook page, or the NBC4 app.